going to talk about today, particularly, are those three areas. So psychological adjustment, insight and challenging behaviour. So sort of three specific bits in terms of the work that I do. And I just wanted, just for a minute, maybe just have a chat to the person next to you about what do you think about when you hear those words? What does that mean to you? What does it, is it something you've come across? Is it something you're familiar with? What do you think it might, what sort of challenges do you think it might have for you in your work? With those three areas. So just for a moment, just have a chat to the person next to you and see what do you think about that, about those three terms. I'm just going to talk about insight to start with. So when we're talking about insight after a brain injury, we're talking about, let's say, how aware somebody is of the difficulties they have. What insight do they have into how their brain's been affected, into how that then, let's say, impacts day to day, and what difficulties it causes them. And it's when we're talking about people's insight, it's understanding, say, what are the difficulties, what are the consequences. It might be how has it affected their mood, how has it affected their behaviour, how has it affected how they sort of interact socially. So perhaps, like we were mentioning, people's personality changes. Are they aware of that they're perhaps different now to how they were before? How it's affected them cognitively. So again, that the memory, the thinking processes, all of that side of things. Often the level of insight someone has is associated with, again, with that sort of chief executive, that the frontal lobes, and if there's been damage there, that might affect the level of insight someone has. And it's not a global thing, so somebody may have insight into a certain part of the difficulty they have, but they may not have insight into other areas. And it is quite common that after an injury, people do struggle to have insight fully into how they've been affected and how they've been changed. And I always sort of think about it, I guess, that for all of us, obviously we are just the way we are. We don't particularly think about it or question it. Our brains are set up in a certain way. It means we think and we behave, and our personalities are a certain way. And when you've had an injury, obviously the brain is changed. But again, for that person, they are just how they are, how their brain is telling them to be, how their brain is helping them think, how their mind is working. So it feels like this is them. And again, so it will vary in how much they will be aware that they may be changed in some way, that things might be different. And often there's very subtle changes, or the personality changes. Again, often something that partners, family members, carers, children will notice. They'll say, Dad's not the same anymore, or Mum's different now, or my husband isn't the same how he was before. But they can't always necessarily put a finger on what that is or why it's different, but they just know it's different. And the person themselves might not be able to recognise that. Or they might feel something's wrong, but again, it's hard to pinpoint what that is. So, and when we're talking about that awareness, as I say, that people certainly suffer from this a lot in terms of how aware they are about their injuries or their difficulties or how things have changed. There may be a very pure lack of self-awareness in terms of the brain might be affected. And so for some people, for example, if their brain's been affected, it means they may have a very pure spatial neglect. So it might be they're completely unaware of what's happening on the left side of their body, for example. So that if they were looking at a plate of food, they would only be aware of eating one side of it. If they're looking down the road, they're only aware of what's happening on one side. And they won't know that they don't have access to this side of what's going on. And so that's a very pure lack of awareness, that particularly due to where the brain's been affected, that's directly causing that difficulty. But you might also have a lack of awareness because of how the brain is working in terms of the cognition. So for example, if someone has memory problems and they can't remember how they're performing day to day, they can't remember the difficulties they're having day to day, then they have a lack of insight into their problems, partly because the memory problem is causing that, so not directly because they aren't able to be aware, but just the memory isn't giving them information to keep up with what's happening. So depending on how their cognition is working might depend on how much they're able to process what's going on, and able to keep in mind the difficulties they're having day to day. And then the other part of it is actually there may be a lack of awareness, a lack of insight into their problems, which is actually much more about being able to recognise it, being able to psychologically say, yes, this is my difficulty, this is the problems I'm having. And so there can be a very conscious or unconscious psychological denial that I have any problems, that there's anything wrong, that I have a memory problem, that I have problems with my speech, that I need care now. So, and that might be, as I say, just their way of coping. It's a very, very strong coping mechanism, saying, no, this is all fine, everything's fine, and not recognising or not being able to say out loud and recognise to anybody that these are my problems. So it is important for us to try and figure out why somebody may be struggling with having insights, because obviously part of everything that we do, and particularly in the work that Laura and I do when we work with people, is we need to help them with their rehab. So we obviously go in and we help try and see what are the problems, what can we do about it. And obviously if that person is saying, I'm fine, there's no problems, nothing's wrong, I can cope, I can go out and spend my money, I can go out and go out all night clubbing or whatever it is. If they're saying, nope, that's fine, that's quite hard then to be able to put anything in place to make it better or to risk assess or to anything else. So it's something that we often have to look at, how do we work with that? And again, that often might be a piece of work that I might do with people in sessions about how do I help them develop their awareness, and how then as a team do we help develop their awareness so that we can start working on the problems. And I guess, you're probably we're going to touch on rehab after lunch, but I think as a team, we, especially in this work, we are always working as a team, and Laura and I and speech and language and physios, we're often all working together, and you guys are all, really crucial in the work that we do, because we might see people for 1 hour, 2 hours a week, whereas obviously you might be with them 6, 7, 8 hours a day or every day or whatever it might be. So you have so much that you can help us with, and equally the other way. So
I was just wondering how important is, of course I understand it's quite important, but if somebody, because I used to work with this guy. He was in his late 30s.
Mm-hmm.
He had I think he had a playground accident when he was 7 or 8,
mm-hmm.
and which caused a brain injury, and from there on, he physically looked all right, but
mm-hmm.
he developed epilepsy because of that. He used to have absent, and he behaved like a child basically, because there was no but he had sort of insight into what his behavioral issues were. So he would say I am angry, and he'll start throwing things at you, and he'll say I'm angry, but it was almost like he couldn't do anything about it. So what do you what sort of is that insight or not for that person?
Yeah, well, that's really good, and that's actually exactly what the next bit is about. So perfect timing of a question, because you're right. So people can vary in terms of how much insight they have, how much awareness they have of their problems, and as I say, they might be really aware of their physical problems, but not aware at all of their cognitive problems or their speech problems or whatever it might be. So it can really vary, but equally they might vary in those levels of awareness or insight. So they might be able to, so it talks there about intellectual awareness, emergent and anticipatory. So they might be able to intellectually say, I've got an anger problem or I've got a memory problem. Mm-hmm. Yeah, so they might be able to know because enough doctors have told them or enough people have said, you've got a memory problem, so you've got an anger problem. So they might be able to say it. So that would be that intellectual awareness. They can understand that's what they've been told, that's what happens after the injury, this is what the problems they have. But that's sort of as far as it goes. So they can't actually then do anything about it. An emergent awareness is where they may have that intellectual awareness, and then they might be starting to recognise when it's happening. So perhaps saying, I'm getting angry, he can recognise it, he can see when it's happening, he knows he has an anger problem, he just recognises it, but then the next step of what can you do about it isn't quite there. So that emergent is when they're starting to be aware of it, starting to actually recognise it when it's happening in day-to-day situations, and maybe starting to put something in place, but not sort of fully. And then the anticipatory awareness is actually that step further of knowing it's the problem, knowing what they can do about it, recognising when it's starting to happen and starting to prepare for it, put things in place, anticipate the problem in advance and have a strategy to manage it. So, and that's where as a team we would obviously want to work people towards being able to get to that point where they can be aware of their problems, be prepared for when it might come up, recognise when it might be coming up and put something in place to manage it. So absolutely there's different levels of that insight. Like I said, it's not global, so there's some people might be aware of, often it's the physical, they'll know they've got a physical problem. Yeah, because it's right there. But those more subtle cognitive problems, their attention's poor, or perhaps they have difficulties with word finding, they may not have as much awareness of that. So there's a young lady that I work with who's had a stroke. She's in her 30s, and she has various difficulties, physical difficulties which obviously she's aware of, and she can say to me, I've got a speech problem, my speech is poor because of the stroke, but she's not able to, she doesn't really fully know what that means day to day. She doesn't really recognise it when it's happening, so she has a lot of difficulty finding the right words and then also understanding what people are saying to her. So although she's very verbal and very fluid in conversation, she'll chat away for as long as she'd be quite happy to. But actually her conversation is very, very hard to keep up with and to keep track of. And she doesn't have any real awareness of that or of what to do about it. So she's very much at that early stage. If she knows it's a problem, she'll tell you it's a problem, but can't really do anything about it yet. And I think insight and this self-awareness is really important because it can, again, impact on everything that the person might be doing. So it can be impact on the relationships, can be impact on whether they're at work, how they're performing at work, their acceptance of care, their ability to engage with the rehab, their understanding of risks, of safety. So people who want to get back to driving. So I worked with a gentleman last year who was in his 70s, I think, 60s, 70s, and he again, he'd had a stroke and he really wanted to get back to driving, and he had no insight into his cognitive problems or his cognitive problems, and particularly had quite poor visual spatial problems. So again, his ability to perceive his environment safely was impaired, but he had no insight into that. So he was very angry with everybody as a team that we were trying to help him understand that, to think about how that's going to impact on driving, and that driving wasn't necessarily going to be something he was going to be able to do. And that was really challenging for him. And he disengaged from lots of people, lots of therapists, because of when they tried to talk to him about it, he would just sack that therapist and find another therapist. So it was a really difficult part of his rehab. And particularly it will affect, obviously, decision making. So how much, I don't know whether you've come across the Mental Capacity Act and capacity of the people you work with. Yeah. So obviously part of that is being able to prove you've got capacity to make the decisions for yourself about whatever area of life it is you're looking at. You need to be able to demonstrate that you understand all the sort of issues involved. So the difficulties you might be having don't necessarily mean you can't have capacity in that area. So if you're trying to choose where you want to live, or you're trying to choose how much care you need, or whatever the decision might be, because you have a brain injury, that doesn't rule you out of having capacity. It's very much, do you understand the difficulties you have? Do you understand how that impacts on the care you need? Do you understand what then care you need because of it? All of that part of it. So obviously if you lack insight into your difficulties, then that's going to affect your ability to demonstrate you have capacity. And so on. So it really affects everything. And kind of going back to the first one, relationships, I think that's particularly hard. So for family members, for loved ones, for children, if the person clearly has difficulties and clearly is struggling and clearly is not able to perform in the same way as before, but they're very much in either denial of that or don't have that insight into that problem, it's really frustrating for people around them and for the families, the carers, if they can see, well, no, you can't go off and do that on your own because you know this will happen, you're going to hurt yourself, whatever it might be, but they keep going off and doing it because they feel, no, I'm fine, I can do this, okay. So it can have a real effect on relationships because they can feel very, very frustrated with that situation.
So lots of people talk about the death of their relative when they go through the brain injury, even though they're there present with them and living with them again. They say that person has died in that accident, and actually what they're doing is living with a stranger because they just don't recognise that personality or understand who that person is. And there is I can't remember the percentage, but the breakup and divorce in relationships with people that have brain injury is huge. I can't remember the percentage. It's very high though.
Yeah.
I mean, we get these sort of issues with a lot of our dementia and Alzheimer's clients as well. Where families need to sort of distance themselves because they don't understand.
Yeah, and that's really difficult because then and often they might get the person themselves, the client, might get quite angry with the family member or carer because they're trying to also keep them safe or trying to help them, and they don't see why. And it's a real challenge. And obviously that's dementia and all of those things are obviously things that we come across in our work as well, either as a sort of condition in its own right, or something that obviously with all our clients they whether they've had a brain injury or not, they have that risk of developing an additional dementia process or something like that. So in terms of thinking about insight, I think for you guys when you're working with people, it's just thinking about being able to talk to them and understand where they're at. What are they thinking? Just getting that sense of what is their understanding of the difficulties they have or not, and so that you have an idea of a level of what they feel is a problem or not. And so just being quite curious about that, like when they're trying to do something, sort of trying to ask them about how do they think they're going to cope with that. Is there anything that might be a problem for them? And just seeing where they're at. What do they understand about it? Or why are they thinking they can manage that? Or what might be the problems in trying to do it? Or what help they think they might need. So just so for you have a sense of where are they at, what do they understand or not understand. I think trying to give them feedback, so obviously saying, well, do you remember last week when we did this and this happened, and actually when we tried this, this is difficult for you because of your memory, so it's hard for you to remember this bit of information, and trying to give feedback, but again in a empathically. It's a really difficult situation for people, and it's going to be really hard for them to hear, and there's a good chance they won't want to take on board hearing any feedback, but it's still helpful for us to help them give that, but not get into that conflict, not get into a disagreement and argument with them about, well, no, you can't do this anymore, this isn't, there's no point getting to that point with them, because if you think their brain is not allowing them, either psychologically or cognitively, it's not allowing them to fully understand. So we have to kind of understand that's where they're at. But we can help them work with them on it, to say, it seems to me like this is a problem, like we're struggling with your memory, or you're struggling with when you're going out and doing this task. Why don't we have a look at maybe keeping a record of it, and let's see how you're getting on, and help them do that, help them be part of it, so we can look at, can we help them monitor and see how do they find the task, where are the problems, and talking about it in that moment, and just helping them develop their awareness in that way, and think about it. But it's a really tricky one. It's really tricky, and it often does need kind of input from kind of therapists and people to help them really develop that awareness. And for some people, it never really develops. So then it's about how, as a team, do we help manage and keep someone safe as much as possible. Has anybody got any questions about any of that? I'm just going to start talking about adjustment, which ties in very much with self-awareness and insight. But when we're talking about psychological adjustment, it is about that process of coming to terms with what's happened, coming to terms with the injuries, the disability, and what life is like now. And it can be a really long path for people. It can change all the time depending on kind of the stage of life they're at and how the injury is affecting them. And so to some extent it's about, I think there's so much involved in the adjustment. It's about being able to let go, in a way, of life as it was before, and accept that this is my life now, this is how my injuries are. And that's, especially when there's rehab, and we were talking about, when people say, when am I going to get better? When am I going back to normal? That it's really tough, because it is going to be, they're always going to have ongoing problems. Of course, while we're working with them, while there's rehab going on, there's always chance for development and progress, and we advocate for that really strongly. We'll always be working with people to reach whatever goals they want to reach. But often it is about being able to get to the point of saying, this is a new path I'm on that will have difficulties, ongoing difficulties, or just be different to how life was before. And so being able to let go to some extent of what life was before, but also to be able to focus on, this is a new path. It doesn't have to be better or worse, but it is a new path. It's a different path from what you were on before, that might have different goals, a different sense of direction. For people as well, it's very much about having to try to come to terms with who they are now. So as we were saying, their personality may have changed, their interests may have changed, their relationship with their partner may have changed. They may actually feel often, and we talked about the kind of how the relationships can deteriorate, unfortunately, after an injury. And sometimes that's because the partner who hasn't been injured can't feel they cope anymore. It just becomes too challenging, it's too distressing, everything's too different, which is understandable. But equally,
have the psychological adjustment.
yeah, so the partner has a lot of, yeah,
Everyone's in that process.
absolutely. But sometimes it may be the person themselves with the injury, they've changed, and actually they don't have the same interest in their partner as they did before, because they are very different and their interests are different and their hobbies are different and everything can be different, their life is different. So for the person with the injury, it's about trying to find a new sense of who they are now. Who are they as a person? How is that different from before? Are they okay with that? Can they be okay with that? So it's trying to go through that, and it's trying to explore that again from a very intellectual point of view, understanding it, being able to have that insight and that awareness into it, but also emotionally being able to process that information that life is different. And I think it's just not straightforward for people, because in every bit of life or every stage of life, that suddenly it might throw out something new. So whether it's trying to get a job and the way the job opportunities you have are different now, or are limited, or you can't go down the road you wanted to go because of your injury, or the career path you chose in terms of school, or the what you hope to do in terms of children or relationships. So at every point of life, you may have accepted a certain bit of how life has changed with the injury, but all of a sudden life might throw out something new, and it's again having to readjust to, okay, I can't go down that path now because of my injury, but I can go down this path and it's different, but can I accept that? Can I adjust to that? So there's a lot that people are constantly having to process and make sense of, and accept. And it is, as we touched on, it's that grief process. It's that some people often have to go through, kind of having to feel the shock at what's happened, denial of that there's anything wrong or anything different, and I can carry on my life as normal and it's all going to be fine. The anger at what's happened, the anger at maybe the person who hit them in the car, the anger at people who won't let them do, the anger at the doctors, the anger at rehab staff for not doing enough. So there can be anger all over the place, the depression and the sadness, of course, and the loss, and getting through to that acceptance stage. So, and it does require having that insight, being able to really fully kind of adjust and accept where you are now, means being able to really recognise where you're at and what your problems are, and recognise that there are problems and there may be ongoing disabilities, and that's tough for people sometimes, even when they have to, perhaps if they're going to college and they could get extra support because they have these disabilities now, being able to actually say that that's what it is really, really tough for people. So I've got a young man at the moment who's had a lot of physical injuries, so he's got lots of metal pins in his legs and bits and pieces, and being able to say he has a physical disability in any area is completely beyond him at this point. He would never want to say that ever, even if it means he can't have the help that he deserves. So it's a really, really tough process, and I think on a day-to-day level it can fluctuate, so some people can have good days and they'll have bad days, and I think again for you guys, the people you'll see that sometimes they'll be okay, but equally sometimes they might be hugely fed up, angry, frustrated, irritated, anything, when they perhaps need to have help to do something. So I've got a client who absolutely hates feeling disabled, and so any time the carer has to help her do anything, it fluctuates. Some days she's okay with it, other days it just drives her bonkers, because she just can't bear that she needs help and someone has to help her, because she can't unwind down the car window, or she can't help herself feed herself because her arms become too shaky. So it's incredibly difficult for people. And again, the more perhaps you try to do and the more you realise you can or can't do, the more that comes up. So it can be an ongoing process really, and can suddenly flare up depending on what's going on for a person and what they're trying to do. So does this sound familiar, perhaps of some of the people that you're seeing and some of the things that are coming up? Yeah.
I think the hardest thing as well is that when we start going through those grief processes, because we're giving them more insight and showing them more, that's when we actually start getting the depression. So you're walking along with somebody working really well, and then suddenly as you're showing that things aren't quite so well, that's where we actually trigger those stages ourselves as therapists.
And that can be difficult. I know that can be difficult for So lots of our clients that we have obviously have kind of carers and support workers working with, and often they'll, they'll come into a session with me, kind of quite happy as they walk in, and walk out sort of quite sad, and the carer say, oh, they've been really, upset all afternoon, it's been really difficult, and which is really tough. It's really tough. Yeah, thanks for that. Which is really tough, because part of that process that we need to help them go through to get to a point where they can sort of feel like they can cope with life is to help them go through that. But as you say, actually when they have very little insight and awareness, they might be ticking along feeling like life's okay. And it's really difficult, and it is getting that balance of how best to manage that. And I think again for you guys it's very much about just being able to listen, hear what they're saying. If you come in and your client's clearly having a bad day, just being able to let them talk about what's on their mind, and you can just do that and listen. You don't have to kind of put in anything or give them any advice. It's just being able to recognise that's making you feel sad today. I can see you feeling frustrated today. Just being able to recognise that that's where they're at, and is there anything I can do? What could I do today that might help? Is there anything that I can help you with? How should we do to get through this task together? Just helping them think about that. And depending on the client, obviously, if you've got somebody, you've come in and they're clearly really unhappy, then you need to sit and chat to them for a bit and let them just talk about it and delay the task you're going to do to let them do that. But then you may know, actually, do you know what? Give them a little bit of time and then go, right, should we carry on with this? Should we crack on with this? And just you can refocus them and get them back into just actually doing something day to day, which can be a helpful distraction. And you can judge that a bit with the client that you're working with. But being a help if you can, obviously recognising where they've come from, what progress they've made, how they're doing, how you did in your physio last week, how you're doing on this, helping them recognise where they're at. Because again, particularly if there's memory problems or anything else, they may have forgotten, they may not be able to hold in mind everything about how they're doing. So helping them with that, but never obviously dismissing or minimising how they're feeling. And just remembering it is a process, though they will go through this process and it will take time. It's not something we'll solve overnight. And it's completely understandable. Obviously, all of us would go through this if we were in this situation. So I just had a couple of examples just for you to have a look at and have a think about. If you take one and pass them around. So there's just a couple of examples of the type of work cases that I've come up lately. So just perhaps have a read and just have a discussion with the person next to you about kind of any thoughts that comes up for you or anything about what we've talked about so far that crossed your mind. Anybody have any thoughts from looking at the case studies, just to give you a bit of a flavour really of the type of difficulty I suppose you might come across? Any thoughts or questions or?
Yeah, I mean, we were just discussing that with Luke. Possibly the challenge would be the kind of time. So I think we need to have a lot of time in our hand to actually sit down, and because I think the most of whenever you're listening to him, the major part of it would be like, I'm angry, I'm frustrated, I'm but not actually talking about the real problems that he has. And then sort of at the end of it, kind of saying to him, sort of, what do you think you can do? Or what sort of work do you think you're doing, and how do you think you're going to do it? And maybe that can provide him. It's not going to be like like a one-day job. It's going to be like an everyday thing. Like Laura was saying, I think before, sort of a repetition and doing it over and over and over and again with him. And kind of refocusing him onto like, okay, I do want to do this, but what are the realistic challenges of that? Yeah. One of the things I was just saying to Naz is about that gentleman I was speaking about before. One of the things we used to do, obviously with his consent, was to video him when he was really angry. And we didn't show him the video because we wanted to have that sort of separation, and we'd submit it to the psychology team, and they would show it to him, and they would say, okay, this week you had say 2 episodes of that, and over a period of time there would be like a chart, and you know, even it was a little bit like, you know, this month you had one less episode than the previous month. For him, it was a real achievement. I mean, that was one thing that we used to do. And we, I mean, the sad part was we thought about it quite sort of later on, and didn't do it straight away from when he started his care under our you know, the care agency. But we do believe, I mean, you know, that if we did do it from the beginning, it would have helped him a little bit more. And the second person, I think, for him again, sort of time, I think, and sort of saying to him, okay, if you think you can go back to your work, how are you going to do that? You know? And I don't know, I like sort of giving him sort of real life examples and saying that maybe, you know, this skill is needed, and, you know, kind of physically doing that, like, you know, how would we prepare this, or how would we do that? I mean, cooking is one thing we used to do with this gentleman. We used to care about, and he wanted to do it. So we said, okay, one day we sort of took him to the kitchen and said, because he just wanted to do it himself, he didn't want any help. And we said, okay, we'll leave you to it and let's see. And when he got there, he was like, oh, I don't really know. So, and then he asked for the help. So I think things like that, so pick up one skill and say, okay, how would we go about it really? How do you want to go about it? And do that. So
Yes, absolutely. I think there's a lot of good things in there. And like I say, obviously, like monitoring, video feedback, they're all really useful things that we can do with people. Being able to keep records of behaviour and how often it happens, that's really, really helpful for us. And like I say, being able to it is really important that we, as long as it's safe to do so, that we do let people explore themselves with us sort of being there for support if needed, but that they're, like I say, that then they can, that's a helpful way for them to reach a point of saying, oh, actually, yes, I do get stuck on this. And looking at it that way. I mean, both of these are, obviously I've changed some of the details, but are current cases that I'm working with at the moment, and both very difficult for them both in their own way. So Luke being actually functioning really well day to day, but if the minute we actually really try and think about what he's going to do and make decisions, then this anger and frustration and agitation comes out, and he gets very stuck, because he gets very stuck on what's happened and how he's wasted time and how the injury has caused him to be kind of, or in his mind, sort of gone back 2 years, or the time it's taken for him to recover, and where he could have been and where he should be now, and he's very fixed on that. And so it's very hard to, like say, being able to then go recognise all of that, but then go, okay, but actually this is where we are now, so how do we move forward, what do we do about it, and helping him with that. And Tom equally, which is a very common thing, is that he recognises he has a physical problem. Although interesting, he only recognises one part of his physical problem, so he recognises the hand, but doesn't recognise that there are equally other areas that are physical rehab that are needed. And he certainly doesn't recognise that there's other areas of the cognitive rehab or his speech that is needed. So he is very focused on his physiotherapy, which again, a lot of our clients are. It's all about, we want to go to physio, but not quite so fussed about the rest of it. But what we know, and particularly for Tom, who wants to go back to quite a high level job, is for him to be able to do that, he needs to be able to focus on the cognitive, how he's going to do all his admin, how he's going to manage all that side of the work, how he's going to communicate with his clients, all of that part of it. And so we know we need to help him get to that point where he can recognise those and be able to work on those as well. So that's our current challenge as an MDT for him. So I'm just going to move on to the last bit about challenging behaviour, which I know you guys mentioned earlier, you've come across. Has everybody experienced this in some way in the work they do, in some form? And I've put it there, it's a kind of challenging behaviour, so all behaviours that challenge either the person themselves, so it can be challenging for the person with the brain injury, but it might not be challenging for them at all, but it might be challenging for the carers, or it might be challenging for family, or just the system around them. So it's something that can happen, not for everybody with the brain injury. Often it does depend. It's particularly, again, corresponds with damage to the frontal lobes. So like Laura was talking about earlier, that ability to control behaviour, being able to control emotions, being able to have that switch that says, oh, don't do that, don't say that, don't act in that way, isn't working so well. And so it often then comes into what we then see as challenging behaviour. But it is not for everybody with the brain injury, but certainly for some people it can be a significant problem. And generally when we talk about it, we talk about anger and verbal and physical aggression. That's often the most common thing people talk about. So when somebody gets either shouting or swearing or getting angry at you or at people around them or at themselves, or physical aggression, again, towards other people, towards objects, throwing things, damaging things. And that's probably the thing that people most commonly think about when they're thinking about challenging behaviour in brain injury. But I think there's also lots of other ways that brain injury can cause someone to behave in ways that we will find challenging. Again, maybe not for them, but we might find it challenging as a team or as a system to manage or to keep someone safe. So it might be just a complete refusal to engage in things, a complete refusal to actually do the sort of things that you're trying to help support them with, whether it's helping them with food choices, whether it's helping them with where they go day to day. It might be a complete refusal to actually engage in anything that you know that's been recommended by the therapy team or anything like that, which actually day to day that's really hard for you when you're trying to go in and do your shift and they just won't do anything that you know you've been sort of supported or trained or advised to do. Inappropriate behaviours or disinhibited behaviours. So again, it's that switch in the front part of the brain that's just not working, that isn't telling that person, you might think that thought or you might think about doing that behaviour, but you don't actually go and do it. But that's not working so well. So it may be that they'll make inappropriate comments to you or to other people, family members, to people when they're out in the community. It might be that they have sort of very sexualised behaviours, just very disinhibited in lots of ways. And again, that can be difficult if you know you're going out and about and you're worried that maybe they'll act or behave in a certain way, or for young people who want to go out clubbing till 4 a.m. and kind of what then they might get up to in terms of their relationships, and it can be then put them at risk of being in a fight because they say the wrong thing to the wrong person, or they become very sexually inappropriate perhaps to somebody's girlfriend or boyfriend, or so it may put them in a really risky situation. And just generally, so people can be very impulsive, and so those risky behaviours might increase. That puts them in a difficult situation. I put excessive behaviour, so just doing things again to excess. So I had a client who would go from smoking 2 a day to smoking 60 a day or 100 a day of cigarettes, or drinking far too much, or just generally gambling too much. It could be just those behaviours that are going on to excess. And just extreme emotional reaction as well, which again can be really difficult to manage. So somebody who may be very emotionally labile and may go from being very calm to the next minute they're really angry and agitated, and the next minute they're crying and they're really distressed. And again, that's hard on a day-to-day basis to try to manage and support someone with. So I think there's lots of other things probably you could put on there, but challenging behaviour is certainly predominantly we're looking at anger and verbal and physical aggression, but it actually can be. In brain injury, there can be lots of ways that the brain's been affected that means how that person is day to day is either challenging for them or challenging for us or you as a team to manage. And that distinction is important because sometimes I think I'll recognise something, or you guys talking to support workers, the carers will recognise something and say, oh, we're really having a problem with this is a challenge, or the person's doing this all the time. And sometimes we do have to kind of take that step back and think, okay, well, this is a problem for us, but actually, is it a problem for them? Okay, this might not be what we choose, but is it all right for them? Do we need to work with them to help them do that safely, or do we need to work with them to help them do that maybe in a slightly different way? But actually, is it more of a problem for us and how we manage it rather than the person themselves having to change that behaviour? And sometimes it is about thinking about whose problem is it, and actually if it isn't a problem for the person, then we need to kind of look at that and just think about what do we do about it, or is it okay that if they want to carry on with what they're doing. So that is something that's quite important when we think about the management. So it doesn't occur for everybody, and it is generally about the damage to the frontal lobes. And the main thing, as a psychologist coming in, that I'm trying to do, and that obviously for you guys when you're working with someone where there is challenging behaviour, is just being able to understand it. So why is it happening? How does it impact on that person? How does it impact on the system? Again, that sort of whose problem is it question. What makes it more likely the behaviour is going to occur? What makes it less likely that it's going to occur? What triggers it? What maintains it? What keeps it going? What situations are we looking at where we know it's going to happen more often? What situations we know it's never going to happen? So trying to understand it is really important. So we recognise the problem to start with, figure out what it is, but then let's try and understand it. And that's really, really essential. I mean, often people, it's really common to kind of say, the person did this, and there was no trigger, and they just kind of came out of the blue. Came out of the blue, yes. No trigger is usually unlikely. There's normally always a trigger. But sometimes it's quite difficult to backtrack and figure out what that trigger is. But generally with behaviour, there's always something that has triggered it. And there's always something that keeps it going. So that's really important. We try and understand it, understand what it's about, and understand how does the person feel about it, what they understand about it, what awareness they have of it. And trying to maintain our empathy. So that's a really challenging bit. Obviously, definitely when you're in a situation day to day, if you're working with someone really challenging, trying to maintain that kind of understanding and empathy, and being able to try and put yourself in their shoes is really tough. It's particularly if there's physical aggression, but physical or verbal aggression or any of the other difficulties we talked about earlier, that's really tough when you're in it day to day. You can, especially if you're tired or you lose your patience or anything else, but it is important that we try to keep hold of understanding this person is being this way because of their injury, and whether it's because there is, I think sometimes with these behaviours we're looking at, is there an organic problem? So is there a problem in the brain, which means they cannot control this behaviour, they can't control their anger, they can't control those disinhibited comments, or is it more of an emotional reaction? So they're getting very angry because they're just so fed up with their life and how it's been affected and everything else. So either way, it's about they are in an incredibly tough situation, and their brain and their emotions will be very difficult for them to kind of make sense of and manage. So it's trying to maintain our empathy for it. That doesn't mean saying it's okay. It's obviously never okay to be aggressive to anybody or any of these behaviours, but we can understand it, which is important. So just when we're thinking about trying to understand challenging behaviour, there's so many things we're looking at. So as I say, we're looking at where has the brain been affected, so what injury does that person have that perhaps means it's more or less likely, or explains a bit about why they're behaving this way. So again, if there's been that damage to the frontal lobes, it might explain a bit more about why they do not have that mechanism that tells them you can control this, that tells them to stop, that tells them to not say that comment. They don't have that mechanism working. Understanding their cognitive impairments, again, if there's memory problems, then they might mean they aren't able to hold all the information that they need to make sense of a situation, and then they react to it because they don't have everything that they need, or a kind of information processing. So I have a client who has a very slow speed of information processing. So when she's in a conversation, especially if there's a group of us talking, she cannot keep up with that conversation, and then we know that is a trigger point for her. She's very likely to at some point get agitated and get angry because she just can't keep up, and she might hear one word and misinterpret it, and then it spirals, and then it goes from there. So understanding how someone's thinking processes may be affecting how they're making sense of a situation, how it then affects how they interpret the situation. So say their ability to process information, but also if people just getting really overwhelmed, cognitively there can be so much overload for somebody after an injury. They're trying to make sense of the noises, they're trying to make sense of the conversation. So often group conversations are quite hard for people after an injury. There's just so much that they're trying to process at the same time that sometimes that can become just too much, too overwhelming. Someone's level of fatigue, as with all of us, if we're tired, we're irritable, we're exhausted, then our tolerance levels are lower. And after a brain injury, fatigue is often a significant issue. So again, if someone's really fatigued, there's a higher chance that they're going to be more irritable and not be processing information properly, and so on. As we talked about, understanding where someone's at in terms of their level of adjustment, in terms of their insight, how much do they understand about their situation. And you're saying sometimes actually the more insight they have, the more that might affect their mood. And we might see more anger and more frustration. So these are all factors that when we're trying to make sense of why someone's behaving a certain way, we have to take into account how much control they feel they have in their life. That's often a big thing, their sense of who they are and how much they feel in control of day-to-day life. And that's often a trigger point for people when they feel like everything's being controlled around them. Everyone's making decisions for them, everyone else is kind of guiding what they're doing. And that's incredibly difficult. So again, that can often be a trigger point of feeling like, I want some control back. And I want to do the things I want to do. And that can often be a trigger for challenging behaviour. Being very egocentric up there, so often a difficulty after the injury is that the person becomes very egocentric, so they become very focused on themselves. It's quite hard for them to necessarily consider what other people might be thinking or feeling, or what how their behaviour impacts on other people. So they may, so I have a guy that I've worked with who has functioning very well, he has a family, he goes to work, he's very high level, but has a significant anger problem. And one of his issues, he really struggles to recognise that this problem affects anybody else, that his partner or his children might be upset by it, that there is anything else really going on apart from him and his injury, which is really difficult for his family and for his children, and also for him to be able to recognise that his behaviour does impact on others and it does have consequences if he gets angry in front of his kids or if he behaves in a certain way to his partner. Obviously the level of someone's impairments, the care needs they have, the relationships they have day to day. So all these things, and these are all so when we're looking at the bigger picture, how a person's affected by all of these things will affect perhaps how then they behave day to day, how this behaviour comes out, how this challenging behaviour emerges. But also, just as we said, the specific triggers, so on a day-to-day level, what triggers that behaviour, so trying to understand. And that's where often when we keep records and we look at trying to track back and look at when something happened, what was the trigger. And that can be difficult, because like I said, we can say sometimes it feels like it happens out of the blue. And it can be a very obvious trigger, my husband did this and it made me angry. So it might be a very specific, they ignored me, they were talking about me in front of me and not to me, that made me angry. So it may be that someone specifically does something, it may be that it's a thought, so the person might be sitting there just thinking about their injury and about their disabilities, or about something that happened yesterday or something that happened last week. So it may, again, that can feel like it comes out of the blue. All of a sudden they've thrown a cup of tea across the room and you think, nobody did anything, what happened? That came out of the blue. But actually for that person there was a reason. Something frustrated them, something they were thinking about made them feel sad or angry or frustrated, and they reacted to that. So I think that's really important, that there is always a trigger. It's just sometimes we have to work a bit harder to figure out what that trigger is. And then how the behaviour is responded to, is say that's equally as important. So what triggers it's important, but equally how do we respond to it? Do we respond in ways that reinforce the behaviour, or do we respond in ways that so do we make it more likely it's going to happen, or do we respond in ways that makes it less likely it's going to happen? And that's quite key. And sometimes for all of us, I don't know, I've got a 4-year-old, and I know when you're in the supermarket and they're screaming and shouting, you'll do whatever you can do to try to make them stop screaming and shouting, even though effectively you might be reinforcing that behaviour by giving them what they want, or by doing something which is nice to make them stop. And so we can all be in that situation, when we do something that actually reinforces and makes it more likely the behaviour will happen again next time. But it's just, again, the more we understand that, the more we figure out what do we need to do, how do we need to respond to it, the better we can manage it. So are people familiar with this, like charts like this, behaviour charts? Yeah. So yeah, ABC charts. So when we talk about looking at behaviour, it's generally broken down into these categories, and you might be asked, again, if there's psychologists involved, or just generally you might be asked when you're looking at behaviour management to keep notes of these particular areas. There might be slightly different wording, there might be slightly different columns in the charts, but generally it always comes down to what's the situation, so where are you, who's there, what's happening. So with the general situation, so in the supermarket, doing the shopping, and then triggers. So what was happening? And I say sometimes you don't need to necessarily, you might not know the trigger, but what happened immediately before the behaviour happened. So trying to describe exactly what happened just before the behaviour occurred. So, these two people were talking about this, and the client was doing this. So just if you're not sure what the trigger was, just trying to describe exactly what was happening. What is the behaviour? So is it verbal behaviour? Is it physical aggression? How long does it go on for? So what's specifically describing that behaviour? And then what's the consequences? So how is the behaviour responded to? What is the outcome? So this is really, really useful information when we're trying to make sense of behaviour. It's trying to understand it, and by keeping records like this, it can help us understand exactly what's happening, and also how often it's happening and how long it lasts for, and so on. So often you'll see charts like this where we look at asking people to track what's going on. So for example, say in a supermarket, so I've got a client at the moment who this is probably a really good example for, who always wants a toy when she goes to the supermarket, and so goes to the supermarket. So she's in that situation with her family. The trigger is she's in the toy aisle, she wants a toy, and she's told she's not allowed one. So instantly the behaviour kind of cranks up, and she's screaming and she's shouting and she's trying to grab things. And the family in that situation, well, this is what we're working on that they will do, is explaining that they would have to leave if she carries on, if the behaviour carries on, and then doing that. At the moment for this particular client, that what tends to happen is the client gets the toy, which then she immediately stops the screaming and shouting, and she's happy until the next time they go to the shop, and then the behaviour happens again. So unfortunately, by giving her the toy, that reinforces the behaviour. It makes it much more likely it happens the next time. So just some examples of how we'd fill out charts like that, and they are really, really, really helpful to document, so that we can really try and understand, so say particularly what the triggers are, because if we can understand the triggers, then we can look at managing it, and if we can understand how people are responding to it, then we can look at the best ways of managing it. So generally when we're looking at management for challenging behaviour, and this is, it varies, obviously it depends on the behaviour, and it depends on, as I say, keeping those charts gives us an idea of what makes that behaviour more or less likely to happen, what is the best way, and for everyone's individual. So there are some strategies that I'd recommend for some clients, would absolutely not recommend for somebody else, but these are sort of some general ones that generally probably work for everybody. So obviously keeping yourself calm, not reacting. So they might be getting angry, they might be aggressive, they might be responding, but our job is to keep calm and to keep that. Obviously if there's two people who are escalating in terms of their voice, their tone of voice, their shouting, etc., then it's going to be really hard. The other person is going to respond to that, the client's going to respond if you're responding. So if you can keep your reactions very level, then that will be helpful. But keeping yourself safe, most importantly, and this is really, really important, obviously you need to keep yourself safe in that situation, and if you need to do what you need to do for that to happen. So it is always important, if you are working with someone you know is physically going to be physically aggressive, then obviously being aware of your space around them, that if they might lash out, that you are kind of at a distance where you've got some space either to get out the door or to move back. So trying to think about that as much as you can. So I've got a client who very, very often throws tea over anybody when she gets distressed. So that's something I'm always very conscious of when I'm sitting with her, where I was sitting in relation to the tea, or if I know that something's about to happen that might raise her agitation, I might subtly move the tea out of the way before it happens. It doesn't always work. We got tea over the carpet last week. But you sort of think, just anticipating these things and thinking about these things. Actually keeping your interaction to a minimum. So if somebody is shouting or being physically aggressive, then they aren't going to be able to hear you properly. We all know for ourselves, if we're cross and someone's trying to talk at you and make you discuss something, you're not really going to hear them. You can't process all that information. And for someone with a brain injury, even more so, they're not going to be able to process if you're trying to talk and explain and have a lengthy conversation with them and tell them why they need to calm down. That's too much. That's too much for most of us anyway, and that's too much for someone with a brain injury. So it's actually keeping your interaction, your conversation, your communication with them while they're agitated as simple as possible, as little as possible really, while you let them just wind themselves back down again. But if you are talking to them, keeping it very simple, keeping very clear communication, but exactly what you're expecting of them. So no, that's not appropriate. I'd like to, you need to calm down, or you need to stop that. But something that's just very simple, what they need to do, what you're going to do. I'm going to go and stand out the door for a moment, explaining it, but keeping it very simple. And only one person talking at a time. So I've often seen situations where there's lots of professionals involved, or carers or family members, and the person gets agitated and everyone rushes in to try to calm them down, to try to sort it out. And actually all that does is spiral the person. There's too much information coming at them, and they just become more and more agitated. So one person at a time, everyone else should stand back. Again, considering your non-verbal communication, so obviously if you're looking like you're kind of threatening in any way to them, intentionally or not, they're going to react to that. So obviously bearing that in mind, thinking about how you're coming across in your body language. Time out is a strategy we do use with people. Again, it's one of those strategies that sometimes I advise to some clients, and other clients it's not appropriate for, because it would just escalate them and they would be even more furious. But time out in terms of, because what we often talk about is when someone's angry or aggressive, the adrenaline shoots up, everything, that sort of fight or flight processes in the body is going on. And normally, it shoots up there, and it needs for all of us, we need about 20-25 minutes for that to calm back down again. So even if you stop shouting, within a couple of minutes, there's still quite a long way to go. And so anything in that 20-25 minute slope, if someone says something or does something, you could be instantly back up there, screaming and shouting. And, and there's been some very unpleasant incidents where people have gone in too soon, or kind of restarted a conversation or restarted an interaction too soon, and it's ended very unpleasantly because the person's been very close to being back up there. So trying to think about that. So the time out strategy can work. So sometimes you can say to a person, do you know what, I'll give you a bit of time, I'll come back and we can talk about it and go agree a time, shall I come back at 10 past and we'll talk about it. So giving them that space, or just saying, do you know what, should we just sit here? I'll just be here, let me know when you're ready to talk, and you could just sit at the side of the room and just wait. So just think about giving that person that space. It's really important they have a chance to calm down.
Can I give an example of a client I work with on the timeout? So one of the things that's quite interesting when you're saying keep yourself safe, obviously, with some of your clients that are physically disabled, and you're doing things like personal care, it's very difficult to keep yourself safe because you're in a very sort of close proximity and supporting, and that can be very difficult to manage sometimes by giving them space and staying away from them when you've got to get on with that job. So I had a particular client who had very, very aggressive, both physically and verbally. So we had all the training with the support workers and everything, and they were given very clear instruction about the time out rule, and essentially was always being given warning and given escalate, if you do this, we will be stepping out, we'll be giving you time to calm down. He grabbed hold of this, and this is where the conditioning came, that he realised actually if he kicks off and he goes crazy and starts thrashing out, he's going to be left alone. So he started doing that behaviour intentionally so that people left and had the time out with him. So we had to flip everything on its head and actually say, we're going to stay with you, to counteract that, because he just got on, he actually learnt, actually if I do hit people, they are going to give me time out, and then good, everyone's going away, and that's what I want to be left on my own. So that's where it backfires, and that's why it's got to be really very well managed with time out.
Yeah.
Sorry.
No, absolutely. But it is, it's one of those ones that some people it will work and it's the right strategy, and some people it really isn't. So it is one. But I think it's important just to understand that principle of actually having that space. And so even if
you might need the space, you might be getting to an escalated place, and you just say, I just can't cope with this, I don't know how I'm going to do this. You're taking the time out for yourself.
Yeah, and that's also really important, that if you feel at any point that you get to a point where you think, I need to step back from this, then that's okay for all of us. Sometimes these clients can be very challenging, and it's okay to kind of go, do you know what, actually I'm going to give myself a minute, I'll come back in a minute, and give yourself that.
Is the time out, would you say that it's more of a trial and error thing, so you try it, if it doesn't work, then you try another way? Yeah. Because if you haven't tried it, you don't really know if it's going to work or not.
Yeah, I mean, it's something that's good to, ideally to almost discussed as a plan in advance. So often I like to have like, this is how we're going to manage it, and and discuss it with the client about when you get cross, how about we do it like this, and should we try that, and trying to come up with that as a plan. Because I think initially, say you can give them effectively do time out, but without leaving the room. So you can, if you're not interacting with them, if you're just saying, I'm just going to sit here and wait till you're ready. I can see you're really cross. I'm just going to sit here and wait. So you're effectively giving them time out to let them because you're not interacting with them. But again, it's explaining it, because if they think you're just ignoring them, then they're going to escalate. So it's
and also it's where you do the time out, because ultimately you could be in the community, in the shops, and it's kicking off. You can't then go, right, I'm just going to give you some time out, because you're then leaving them at risk. So again, it's how you...
Yeah, so it's a more trickier one. I think it is, it's important that often when someone has had the chance to calm down, then if you can, or again, if you've got that relationship with them, be able to sit and say, well, what was that about? Let's have a chat about it. Let's think about it. I can see you got really, really angry this morning. Letting them talk about why do they get so angry? So then again, help you try and understand what the triggers are. What could we do about that? How could we avoid that next time? And just being able to talk it through can be really helpful. And that sort of empowerment approach, helping them talk about it, helping them explain so that you're understanding them. But also, what can we do to help? Well, how should we manage this next time? If this happens again, what can I do that's helpful? So trying to get them to be part of their plan of management is really, really useful.
Well, generally, is there anything, because I know if you're in their own homes, or sort of within four walls, it's a different thing. But like Laura was saying, if you're in the community. I mean, what are the general things that you should do? Like when somebody does have having a complete sort of episode of being very angry, frustrated, screaming, and most of the time what happens is probably the store manager is kind of going, can you please remove this person? I'm like, physically cannot remove this person. What I mean, is it just better to stand back and wait for them and explain to the other people that this is what the strategy is?
I think I mean, obviously you could say, I think if at any point if someone's doing something that isn't acceptable, it's a bit about that kind of don't support the behaviour if you're concerned about harm to self or others. But if they're doing something that it's not acceptable, and it's kind of being very clear with them, saying you need to stop now. This needs to stop while we're here, but we're going to have to leave. I'm going to have to speak to the store manager. I'm going to have to, explaining to them again, keeping it simple, as brief as possible. Explain this needs to stop. What they said, they need to stop the behaviour, and then what you need to do about it. So, like you say, I think if they're in the store and clearly there's people looking concerned, you need to perhaps explain to the store manager. I think again it'll be different for every client, so it's quite tricky to say. So for some people you may be able to, obviously if they're in a wheelchair, you may have to say, I'm going to have to take, we're going to have to come out of the store now, I'm going to have to take you out, and obviously if it depends on what sort of wheelchair it is, you may be able to push them out, but again explain what you're doing before you do it. Or if like you say, it's not safe for anyone to go near that person, then like you say, you speak to the store manager, and ultimately then we have to put the same thing as anybody who would be behaving in that way. So if they need to call the police, if they need to involve whatever strategies they would need to put in place, if they're able to wait for that person to calm down, if it's safe to do so, then fine. But actually if they're going to be a harm to themselves or others, then we have to just look at whatever support is needed, as it with anybody who is doing that in a public space, to keep you and them and the public safe.
Well, we have one client who kind of just goes out in the community and she just runs, just across the road. Whatever, she doesn't really think about safety. And I think we have had sort of tried to explain it to her and things like that, and sort of together come up with that it's not feasible for the carers to then run after her, and she doesn't like it. It escalates, doesn't it?
So the police called them a couple of times.
And that's sort of is the risk assessment that you've done, and we said you follow her as much as you can, but there is there's a limit to.
And that's where often, like you say, it comes down to having that conversation with, obviously when she's calm and when she's at home, perhaps when she's back at home and she's calm, and it's a good place to talk it through about that behaviour. What does she understand what the risks are? And it kind of goes back to the capacity issue as well. Does she understand the risk she's putting herself in? Does she understand the issues if she goes out and runs across the road? Has she got that awareness? Because if she does, then like you say, you can come up with a plan of action with her about it, but equally if she doesn't, then it's probably a slightly different approach, because you're thinking, well, she's not aware of the risk she's putting herself in, and therefore is it safe for you guys to take her out?
Have a conversation with her about it, like her general,
I think
or she just doesn't want to accept
there's no
it.
question about her insight, like about she knows what things.
She does, but she's getting better. So she had a tumour, and over the years she started to get better in terms of behaviour and things like that. But understanding, she does to a degree. But then when she hits that point, when she escalates, she
Yes.
does.
Yeah.
So that's-
Yes, and that's often an issue, and that's where it's often helpful, and that's quite common for people. So they may, when they're calm and in a good place, be able to talk it through and understand it, and be really like, yeah, I don't want to do this, or I don't want to behave in this way, I know that this doesn't help, and they'll be able to think it all through. But like I say, in that moment, that all goes out the window, which again can be similar for most of us if anger or anything else takes over.
Is there a team involved with her? Has she got neuropsychologists and
She does.
neuropsychiatrists?
Yes, it's all.
I'm on the one that we are going to arrange for the meeting.
Yeah. I mean, often, the way the approach particularly that I work with people on is kind of an empowerment behavioural approach, and it is that idea of in that exactly that sort of situation. If someone, when they're calm, is able to demonstrate the capacity that they understand the problem, they understand their behaviour, understand the risks it puts them in, and then they're able to think through, okay, this is how I want it managed, this is how I want, you guys to help me in that moment when I lose, like say, the ability to respond in the right way, regulate myself. What should you do? How is it that you, like say, you agree that you call the police, or you agree that you do, X, Y, and Z? And this is what is going to happen, and that's what you're going to do. So it's that's that empowerment behaviour part where we help the person themselves come up with the plan. And then when in that moment you can say, well, this is what you've asked me to do, so this is what I'm going to do. And it helps create, it helps them feel in control, even in that moment of that they are in control of how their behaviour is being managed, which really helps. But for that, they do have to be able to understand it, in that moment when they're calm. They need to be able to come up with that plan. But that can be the most helpful way of managing it, because they are part of it, rather than kind of us as a team coming together and saying, well, clearly this is what we need to do, and we're going to enforce this onto that person. But if we can get them to recognise, okay, this is my problem, this is how I want you, this is what I want you to say to me, this is what I want you to do, this is how I want you to help keep me safe.
And that's where the ABC charts come in, really. That whole, what is the trigger to get her to that point? Is it when she's really fatigued and she's just completely shut down, not really taking anything on board or understanding? And that's it, she's on the fight, she wants to get out of there? Or is it just, it's understanding and unpicking it all to really understand what the fun, probably it's escaping support workers because she doesn't want to be looked after, she doesn't want bodyguards.
That is one thing with her, isn't it? She's very independent.
And then it's about, okay, bring it right back to the activity and talking to her, which we'll talk about in rehab, about graded approach, saying, okay, we need to build your trust in, okay, if you want to go and do these things yourself, let's build that in and risk assess it and put steps to achieving that, so that you can go to the shop on your own and come back on your own and be able to do that safely. And that's the kind of thing that you do within rehabilitation.
Yeah, and that, like I say, is where you can also kind of put in those consequences. Actually, if this keeps happening, then we will have to stop doing this, or and working it that way. I'm aware of the time, so I'm going to have to stop. Although I have got to the end, there was just a couple more case studies I could have showed you, but
Are there any questions at this point? I mean, I'm here all afternoon carrying on and everything, but Emma's leaving now, so leave it. If there's anything, I can always ask her on your behalf.
And that's fine. And I mean, I'm happy with my email. You can get in touch if you need anything. I mean, I think in general, it's just it's as with anything in brain injury, it's so individual and it's so different for every person about why they might be behaving in a certain way, what the behaviour is, and how it's managed. And trying to get that individual plan for that person is the most important thing. There's something else I want to say, but it's gone out my mind. It's gone.
Coming on to communication.
Yeah, it's wearing. It'll pop back in a second. It's going to annoy me. Something else. I'm sure it's a good point. Anyway,
it's the three factors. I'm going to keep coming back to those three factors: the person before, the injury, and the injury site, and then basically what happens afterwards. It's the key. That is your key to understanding rehabilitation and brain injury recovery and the process. So those three areas.
Yeah, I've remembered it. Thank you. I suppose just recognising that obviously, and you'll have some experience with this already, but with any challenging behaviour, it's tough on you guys. It's tough on, for all of us having to be around it, having to manage it all the time, having to try to judge, like say in that situation when you're in the supermarket, oh God, what do I do best here? How do I help this person? Or if it's coming at you all the time, you're constantly having sort of verbal aggression or physical aggression towards you, that's really tough, and it's making sure that obviously you guys get support for that, and that you don't have to stay in a situation where you feel threatened, or we would never want that for any of the the people we work with. But equally, that I think if we do work together and understand that behaviour and come up with a plan, then we can reduce behaviour. Can be supported and managed and reduced, even the most challenging ones. It's just kind of getting that right, understanding that right plan in place.
One of the things I was thinking about, like just going through sort of the care plan and stuff. So do you think that in the risk assessment itself, you should also talk about the carers themselves, really, and also say that because I think that is the biggest support system for the person, and to say that what works for them and what doesn't work, maybe sort of break the shift down. I mean, I'm not talking about this particular person, but
sometimes it is.
And change the things.
But sometimes there's
and you is it
because there might be
something
specific
that
times that it kicks off, or the behaviour is challenged or triggers and everything. And again, if that one person is always on a shift, they are going to get the brunt of that, and they are going to get affected the most by that. So again, it does need to be looked at as a whole, in the sense of what are the shift patterns like, or do you need 2 on 1 at that point in that part of the day, or does that particular activity create more of a challenge? Therefore, risk